Thank you so much. Respected panelists and honorable audience, I don't have any financial interest doing this presentation. Some interesting topic it is. It is a little research done by me and my residents. Serum complement C3 and primary open-angle glaucoma. So, slide is not changing.
Slides, please.
So primary open-angle glaucoma is a global burden, over 70 million affected worldwide. Primary open-angle glaucoma is 6 times more prevalent than the angle closure glaucoma, and the total prevalence is 3.54% among people aged 40 to 80 years. In Bangladesh context, it is 2.1% of the definite glaucoma, and 70% are the primary open-angle glaucoma. We know the risk factors: age, ethnicity, male gender, genetics, high intraocular pressure are the main risk factor. But what about the biochemical risk factors? Actually, can the complement system can be a risk factor for development of glaucoma and the progression of glaucoma? Let's see. Role of the complement system, we have to know. It's a part of the innate immunity system. We have 20 proteins total, including the serum complement C3. We have 2 parts, the serum complement C3A and C35, linked to the glaucoma. Complement activation usually observed in different glaucoma study, usually in case of neurodegeneration, and C3 deficiency linked to early glaucomatous damage. So there is a very important study was done in the AIOS. It's a published study. Just C3 deficiency may cause neurodegeneration in the retina. So what is my objective? To assess the association between the serum complement C3 level and the primary open-angle glaucoma and its severity, to compare the C3 level between the primary open-angle glaucoma and normal individual, to explore the role of complement C3 in glaucomatous neurodegeneration. So clinical and laboratory assessment, we have in the ocular examination, to diagnose the case, all the ocular examination, we have to do investigation, we have to confirm that is the case of primary open-angle glaucoma. But how we can assess the C3 level? C3 level should not be affected by any other blood disease or liver disease. So we have to measure the complement C3 level, liver function test, and complete blood count. How did measurement the serum complement C3 level? A peripheral blood sample was collected. It was then sent to the microbiology department, ensure complete clot formation. This is very much important. The complete clot formation is very important. Then it should be centrifuged 2000 RPM for 10 minutes. After that, serum and blood clots were separated and 20 times dilution was done. Then serum was analyzed with Siemens BN Pro spec system. A result was obtained digitally by nephromatic method, and it should be under minus 40 degrees centigrade. So it can be done in the combined hospital where the biochemistry and microbiology department is very strong. Severity of primary open-angle glaucoma, how could we assess? In different studies showed that mean deviation, if it is less than 60 decibel, is considered as mild damage, and if it is minus 6 to minus 12 decibel, it is a moderate damage. If it is more than 12 decibel, it is a severe damage. If it is a more than 20, that is advanced. Most of the patient in our study, it is a 47.5% has a severe glaucomatous damage, and 27.5 has a mild, and 25% had a moderate glaucomatous damage. So all the patients have age usually more than 40 years of age, and most of the patients were male. Here is the interesting finding. You can see the serum complement C3 level comparison to the normal patient. In a glaucoma group, the serum complement C3 level is lesser than the normal. And in case of severity, in case of severe glaucoma, the serum complement C3 level is the level is more or less. and compared to the moderate and mild glaucoma. And multiple regression analysis showed there is no relation between the intraocular pressure, vertical coverage ratio in both eye. So serum complement C3 level, overall findings is with the advancing glaucoma, serum complement C3 level become reduced. Gender specific finding, in case of male, serum complement C3 level, male glaucoma patient, it is more or less. It means the male gender have a less serum C3 level, and they are more prone to develop the progression of the glaucoma. So what are the actually the clinical relevance? Elevated intraocular pressure. It's a very interesting thing. Elevated intraocular pressure triggers the complement system activation. So ultimately serum C3 level become activated, and serum C3 level become activated, and it becomes split into serum C3A and C3B. And ultimately free serum C3 level become reduced. And immune cell infiltration observed in the aqueous humor and retina due to high intraocular pressure in different studies. Complement C3 and POIG severity. Systemic implication. Reduced C3 level may increase infection susceptibility, creating a vicious cycle of activation and depletion. Elevated oral bacteria and Helicobacter pylori infection linked to the glaucoma. Very interesting. And those patients have a less serum C3 level, they are more prone to develop the Helicobacter pylori infection. And those patients have also more prone to develop the progressive POIG. Genetic and structural factors, C3 gene mutations or structural abnormalities may underlie low serum C3 level in primary open-angle glaucoma. So genetic association also occurs. How the C3 causing the neurodegeneration? Actually, C3, it creates a membrane attack complex, and it just destroy the neuroglia and also neuronal cells, and ultimately there is a lack of conduction of the cells. So when it is activated, it becomes the serums C3A and C3B, and these become dysregulate the neuroregulation. So recommendation. Future research direction, longitudinal studies to evaluate temporal changes in C3 level and glaucomatous regression. These studies is still going on. Investigate the relationship between the primary open-angle glaucoma duration and C3 level. Explore serum immunoglobulin G autoantibody and primary open-angle glaucoma patient. Measure serum C3 and C3A level in aqueous humor. Therapeutic implication. Obviously, complement modulating therapies can be offered, and in future, the new anti-glaucoma medication can be revealed. So conclusion, serum C3 level are significantly lower in the primary open-angle glaucoma patient compared to the control. Association between serum C3 level and primary open-angle glaucoma severity has been found. So complement system dysregulation may play a role in the primary open-angle glaucoma pathogenesis. Further research is needed to explore the therapeutic intervention targeting the complement system. Thank you, everybody. Thank you for the patient sharing.
Thank you so much, sir, for this interesting inputs.